This conference will now be recorded.
A very good evening and a warm welcome to one and all present here. I'm Ms. Neha Mahajan, Executive Organizer. On behalf of Biosetup Life Sciences, take this honor to welcome our Founder Coordinator, Aryadeep Das sir, Dr. Subendu Bandopadhyay, and our today's eminent speaker, Dr. Kalliopi Megari. Faculty members, organizers, and all my dear student participants, I welcome you all for the online webinar on the topic Neurocognitive Outcomes of COVID-19 in collaboration with Lab of Cognitive Neuroscience, School of Psychology, Aristotle University of Thessaloniki, Greece. Before starting the session, let me tell you about Biosetup Life Sciences. Biosetup Life Sciences is a hub of scientific research and learning approved by ISO 9001 2015, certified organization having multidisciplinary team of faculty and research associates that provide support to aspiring students in life sciences. We have successfully organized many workshops, certification courses, career counseling, and competitive exam preparations such as CSIR, IIT JAM, GATE B, IISc, DBT. We are continuously working for the career upgradation of the students. Without a further ado, now I request Dr. Subendra Bandopadhyay sir to introduce our today's speaker. Over to you, sir.
Okay, thank you, Sneha. Am I audible?
Yes, sir, you're audible.
Okay, thanks. So, today we have a very interesting topic to discuss, and the topic is neurocognitive outcomes of COVID-19. So, just a few days back, the whole planet Earth was suffering from a deadly disease that was COVID-19. We all know, and it really hit hard. It hit our humanity really very brutally, and we are still suffering from that particular pandemic. I would not say that it has gone. So we are still suffering. So it has been found that in post-COVID brain is associated with different types of disorders, and in several publications and research studies, it has been found that symptoms similar to what is experienced like Parkinson's disease that has been appeared uh, for the patients who had suffered COVID-19. So this is a very interesting and very important topic to discuss now. But before we start hearing from our speaker, let me introduce her. We have today with us Dr. Kalliopi Megari, and she is a postdoctoral researcher and obviously a lecturer in the University of Thessaloniki, Greece. So let me tell very briefly about her. She has graduated from Aristotle University, Greece, and then she done her master's and PhD from the same university.
Excuse me, sir, you're not audible. Subendu, sir, you're not audible.
This
Okay,
Yes,
conference
sir,
so
you're
will
audible.
now be
Please
very
recorded.
sorry. Okay, so there was a internet issue from my side, so I'm really very sorry. So again, I would like to start from the beginning, that we have today a very eminent speaker with us. She is Dr. Kalliopi Megari, and she is from University of Thessaloniki, Greece. She has graduated from Aristotle University, Greece. She has done her master's and PhD in neuropsychology from the same university. She has experience in working in hospital and healthcare industry, having skills like clinical neuropsychology, clinical research, medical education, psychological assessment, and learning disabilities. She is a global engagement representative of SLC International Society. She is also a global membership committee member, International Neurophysiological Society AGPA. She has different prestigious awards to her name, and she has given several lectures in very reputed institutes like Aristotle University, then Norwegian University of Science and Technology Oslo, and many more. She is presently a postdoctoral researcher and lecturer in the University of Thessaloniki, Greece. So now, without much delay, we would like to hear from you, ma'am. So the stage is all yours, please.
Good evening. Thank you very much for the invitation and for your presentation of me. Indeed, it's an honor for me to be here with you today. I see that there are more 100 people, and I'm glad about it. It's very impressive that the people are interested in knowing and finding out about this disease, COVID-19, and its implications. Because there are many implications, neuropsychological and neurocognitive implications. And the COVID-19, the disease is still proceeding. And in Greece now, every family has a patient, almost every family has a patient with COVID-19, either slight or symptoms or heavy symptoms. And this is very important. Now, let me share my screen to begin with my presentation. Okay, I'm sharing my screen now. Can you see my screen?
No, ma'am, it's not visible. Yes,
Because I
it's
see
visible now. Yes, yes.
it's visible now. I'm
It's
glad.
visible now, ma'am.
Yes, yes,
Okay.
it's visible.
Oh,
Thank you, ma'am.
okay. I will begin now. I will speak about neurocognitive outcomes of COVID-19. Before I start my presentation, let me introduce myself, my city, and my university. I am Dr. Kalliopi Megari, a postdoctoral researcher at a lab of cognitive neuroscience, Aristotle University of Thessaloniki in Greece. Oh. A technical problem, sorry. Okay. I'm a lecturer at University of Ioannina in Greece and University of Western Macedonia. I'm the head of the Center of Creative Activities of Children with Disabilities, Municipality of Kalamaria, Thessaloniki, Greece. I was a counseling psychologist at Prison of Thessaloniki, Diavata. I am a global engagement representative of International Neuropsychological Society. Research fellow at University General Hospital of Thessaloniki, AHEPA, the Department of Cardiothoracic Surgery. I'm editor-in-chief of Journal of Psychiatry and Mental Health, and I'm a General Secretary of Board of Directors and Ethics Committee President of Hellenic Neuropsychological Society. Now, let me introduce my city, Thessaloniki. Thessaloniki is the second largest city in Greece. Its nickname is the co-capital, a reference to its historical status or co-reigning city of the Eastern Roman Byzantine Empire alongside Constantinople. Thessaloniki is Greece's second major economic, industrial, commercial, and political center. It's a major transportation hub for Greece and southeastern Europe, notably through the port of Thessaloniki. The city is renowned for its festivals, events, and vibrant cultural life in general, and is considered to be Greece's cultural capital. This is my city, Thessaloniki. You should come when you have the chance. It's a beautiful city. And these are the historical monuments of the city, which are by the sea. Thessaloniki has a lot of historical monuments, and Thessaloniki is a city with ancient history, with rich ancient history. Now, let me introduce my university. Aristotle University of Thessaloniki is the largest university in Greece. The main campus is located in the center of the city of Thessaloniki and covers an area of about 33.4 hectares. It comprises 10 faculties, which consist of 40 schools and one single school faculty. Aristotle University strengthens our role in the European and international knowledge community by building upon collective and personal academic achievements, enhances our visibility among the traditionally prestigious academic institutions all over the world by establishing long-term cooperation schemes at research, education, and training level. This is the campus, the main campus of Aristotle University of Thessaloniki. And now, School of Psychology. Founded in 1993, the School of Psychology has a worldwide reputation for high-quality teaching and research. The school also provides students with theoretical and practical training directly related to their main field of study, aiming to prepare them for further study in disciplines related to psychology. The School of Psychology consists of 3 departments, which coordinate teaching and research, implementing programs and activities that help faculty members fulfill the multiple roles. There is a Department of Experimental and Cognitive Psychology, the Department of Developmental and Educational Psychology, and the Department of Social and Clinical Psychology. Offers BA Honors, Master of Science and PhD degrees as part of its undergraduate and graduate studies program. And this is the School of Psychology of Aristotle University of Thessaloniki. It's a historical building in the center of the city. Aristotle University is located in the center of the city of Thessaloniki. And now I will speak about my research, which was held in HEPA University General Hospital, which was the first reference hospital for COVID-19 patients in Thessaloniki. And this is me working at the HEPA University General Hospital, treating the patients. Now, let me tell you about the theoretical background of COVID-19. A novel coronavirus, SARS-CoV-2, currently led to previously unknown COVID-19 pandemic. The clinical profile of COVID-19 infection ranges from asymptomatic infection to severe pneumonia, acute respiratory distress syndrome, and or subsequent multi-organ failure, myalgia, and fatigue. In addition to the lungs, COVID-19 may cause damage to many systems, such as the heart, the kidneys, the liver, and the brain, as well as the blood and the immune systems. As you can see, there are a lot of problems that can cause by COVID-19. There are millions of cases around the world. In Greece, the first case of COVID-19 emerged on 26th of February 2022. And of course, it's a disease that is still continued. And there are a lot of cases now in Greece. The map of COVID-19 in Greece, the areas with dark red color has many cases. as you can see by the map. And this is the map of Europe, with the red dark color means many cases of COVID-19 patients. There was a pressure of COVID-19 for the national health system of all countries, and implications for clinical management. Nurses and doctors are at the front Psychologists have a very important role, because COVID-19 has a lot of implications affecting neuropsychological system and psychological system of the patient, meaning the brain, the cognitive functions, and the emotions of the patients. The psychological effects of COVID-19. The novel coronavirus pandemic rapidly spreads across the world and is inducing a considerable degree of fear, worry, and concern in the population and among people with underlying health conditions, older adults, and healthcare professionals. The psychological effects of COVID-19 pandemic include panic behaviors, to pervasive feelings of hopelessness and desperations, which are associated with negative outcomes and further negative emotion as well. The main and important psychological sequelae are increased rates of stress or anxiety, high levels of loneliness, depression, alcohol and drug use, and self-harm or suicidal behavior. Stress, anxiety, depression, frustration, uncertainty during COVID-19 outbreak emerged progressively. In addition, a great amount of distress, social isolation, and frustration are related to the consequences of COVID-19 pandemic. Another important factor is that COVID-19 leads to dysfunction of the brain and brain functions. Neurocognitive functioning of COVID-19 patients. Studies describe patients who suffer from acute central nervous system symptoms in individuals affected by COVID-19, such as inflammatory central nervous system syndromes, encephalitis, cerebrovascular or confusion, altered mental state, headache, dizziness, impaired consciousness, ataxia, acute cerebrovascular disease, and epilepsy, sensory-related symptoms, hypogeusia, hyposmia. It's reported by studies that course of the infection is mild or asymptomatic in about 80 to 90% of cases. Moreover, COVID-19 may cause damage to many systems and the brain as well. Studies describe patients affected by COVID-19 who suffer from acute central nervous system symptoms that can cause permanent cognitive as well. Symptoms from central nervous system are more common in older patients and those who have more underlying medical diseases with vascular risk factors such as hypertension, diabetes, or obesity, and to be less likely to show the most typical symptoms such as fever and dry cough. This variety of symptoms have an important social impact on patients, families, healthcare professionals, and society as well. Now, our study, the method. We studied 20 patients, 8 female and 12 female with COVID-19 with a series of neuropsychological tests at 3-month recovery follow-up. Their mean age was 49 years old, while their mean education years was 16 years of education. This is the neurocognitive test battery that we have used. As you can see, we have assessed a broad range of cognitive functions as well as emotions and quality of life, because emotions are very important and can have an impact on neuropsychological performance as well. And we wanted to see the psychological effects of COVID-19 as well. We assessed short-term retention, verbal working memory, executive functions, attention, visual spatial perception, short-term memory and learning, long-term memory and retrieval, recognition, depression, positive and negative mood, and anxiety as well. This is our preliminary results. The female, as you can see by the graph, the female have important performance compared to men. And neurocognitive decline, there was neurocognitive decline to all patients compared to healthy adults. Our conclusions. We say that it's very important that healthcare costs to be reduced, leading to recovered patients' optimal neurocognitive functioning. Permanent cognitive dysfunction influences independent living. Cognitive decline is an important problem for the patient and family, and also for the community. It causes major financial burden of medical costs to the family and health services, and impacts independent living and daily activities of patients with COVID-19. This cognitive dysfunction, which is limitation in cognitive functions, has an additional social impact on independent living, on patients' families, healthcare professionals, and society. Psychological preventing strategies at the community level, such as implementing effective communication and providing immediate psychological services, will increase the psychological and psychosocial impact of COVID-19 outbreak. It's important that healthcare to focus on medical and psychological treatment for patients and families' optimal functioning. And neuropsychological outcome is an important factor for preserving quality of life and has important implications regarding future design of rehabilitation programs, neurocognitive rehabilitation programs that contribute to better patients' outcome. Perhaps the best way to appreciate the importance of cognitive system is to consider what it would be like to live without it, as cognitive system is not a single organ like the heart or liver, but an alliance of systems that work together, allowing us to learn from the past and predict the future. And of course, we don't forget that neuropsychologists play a very important role in the battle against COVID-19, and neuropsychologists as well play a very important role. And a psychologist and a neuropsychologist is a specialty that must be in a scientific team alongside with nurses and doctors for the better treatment of COVID-19 patients. Thank you very much for your attention. I will be happy to answer all of your questions.
Ma'am, you're not audible.
Can you hear me now?
Yes, yes, ma'am.
Yes, I have finished my presentation. Do you have any questions?
Dear participants, if you have any question, you can put your question in the chat box. If you do not have any doubt, kindly mention clear, ma'am. I will be posting the feedback link. A humble request to all the participants to please fill the feedback session.
I think we have a question. Is there any difference in psychological response with respect to the severity of COVID-19 disease and variants? Yes, there are many differences according to the severity of COVID-19 disease. Of course, all COVID-19 patients suffer from psychological effects, either slight or more severe. And as you can imagine, can you hear me now?
Yes, ma'am, you're audible. You're perfectly audible.
Okay. And as you can imagine, if one patient has more severe symptoms, is more likely to suffer from psychological effects and neuropsychological effects as well. If a patient is in an intensive care room, will suffer from neuropsychological effects because COVID-19 has an important implication in the brain as well. After when he or she exits intensive care unit, psychological problems will be more prevail, because the problem the problem of the patient will be that he or she will suffer from anxiety, depression, and he will be more likely to seek psychological support. I will read, there are some more questions. I will read the questions. Good evening. Would you please explain what was reason behind difference between male and female result? I think that we didn't study this, but in the literature, there are articles that say that female has lower mortality and morbidity compared to men. This is not only the finding that we have seen, but in the literature there are articles that spot this phenomenon. And in Greece, the number of men compared to women of patients are increasing. More men, slightly more men have COVID-19 than women. Another question is, can we cure this via gene modification? I'm not sure that I understood this. I don't know. This is not my specialty. If we can cure this via gene modification, maybe we can study this. And why females are better survivors. Maybe this has to do with plasticity. Maybe one reason, plasticity of the brain, because there are researches that say that females have more plasticity in the brain. That means that if a woman suffers from a neurological or a brain injury, from a neurological disease and brain injury, her brain is more flexible, a kind of more flexible compared to a man's brain. Can you tell me why there is habitual modification of the said virus when there is seasonal change? I didn't understand the question. Can you write again? Can severe cases of COVID infection, even after proper recovery, can it cause long-term decline of mental health in patients? We have two different situations here. One thing is the psychological health, and the other thing is neuropsychological health. Neuropsychological health has to do with brain health, and mental health has to do with the emotions, the psychological factors. More severe cases of COVID-19 patients are more likely to suffer from psychological effects, while not so severe cases, the cases with light problems of COVID-19 may not be suffered from neuropsychological changes in the brain, but they will suffer from psychological effects of the brain, because psychological effects are everywhere in the patients, are prevalent in all patients. Because when you are ill, you will have to be inside your home and not to be in contact with other people, physical contact. So this is the fact of that can cause psychological problems. Another question. Well, then, kudos to Dr. Megari. Thank you very much. The questions that I would like to ask you is this: aftermath of the pandemic that we have just recovered, the new variants of COVID-19 that are emerging in parts of China, how could you approach it? Is it to be encountered with new vaccination, or need to be worried, or still it can be a mindset of living it as it is? Well, this is not my specialty. This is not my specialty. But if I can answer as educated female human being, I would say that scientists, infectiologists, and other scientists say that when many people are patients and they have the virus is more likely to be less strong. So I don't know, scientists say things like this. Another question, during high peak of COVID-19, fear was also the reason of death or not? Well, this is a very important thing that you spot here, because someone is afraid, there is fear is a psychological factor, but fear can cause high blood pressure, and psychological factors have an impact on the body, of our body, with increasing high levels of blood pressure, high levels of glucose, high levels of cholesterol, and this can cause heart problems. So yes, we can say that fear can be a reason of death. It can cause heart arrest and cardiac arrest. Yes, this is. Okay, thanks, ma'am, but how females have more flexibility? I mean, in their brain. Because research says that this is a fact, and maybe has to do with female hormones as well. Another question, ma'am, does different kind of vaccines have different neurological response in patients, or it's the same? Different kind of vaccines. We haven't studied this factor or this question, but this could be a very important topic to investigate. maybe different kind of vaccines, maybe. We are not sure because we haven't studied this yet. Okay, thank you very much for your attention. I hope I have answered all of your questions. There are a lot of questions. There are other questions as well. I have seen so many COVID patients in India. Why there is a multiplicity of symptoms when there is only one virus present in all around? Well, there is one virus, but one virus can have different effects on different organisms. And each of us is different. Psychologically, physically, we are all humans, of course, but different patients have different stages of disease, and different patients are different. And when someone has slight symptoms, may be psychologically affected in a negative way, and maybe someone else who doesn't have light symptoms and have severe symptoms may have some defense mechanism, psychological defense mechanism that can handle the illness, the disease better because of the psychological defense mechanisms. And they have more tolerance, psychological tolerance as well. Maybe I am a neuropsychologist. I can speak from the neuropsychological and psychological perspective, but the immune system of different patients is different, and the immune system of each patient can be different. So that's why there is one virus, but many variants of one virus, and can cause different problems to different people. Another question, good evening, ma'am, about post-COVID era, by which amount of time this physiological complication will develop, and will this affect a mass in a major way? You mean the psychological complications? If you mean the psychological complications, the psychological complications are still present, because COVID-19 continues to cause problems. So psychological complications can develop immediately. Okay, thank you, ma'am. So can we increase flexibility in males via hormones or modification? Well, we can increase flexibility in males. We can. I don't know if we can via hormones or modification. What do you mean by modification? Hormones are not my specialty, but I can say you that neurocognitive exercises and exercises that with memory, with attention, with increasing memory, with increasing attention, with increasing cognitive function, is like a muscle. When we do exercises, when we do physical exercises, we exercise our body. We exercise the muscle of our body. That's the way it is with the brain. We have exercises that are increasing the function of the brain. And yes, we can increase the flexibility in males. I don't know if we can do it via hormones, to be honest with you. So, are there any questions? Thank you very much.
Dear participants, if you have any question, you can use the chat box. If not, kindly mention clear, ma'am, so that I'll be sending the feedback link. A humble request to all the participants to please fill the feedback form and then exit the session. I will also share the Biosetup official WhatsApp invite link if you have not joined any of our WhatsApp groups, so you can join it. Last but not the least, I would like to propose the vote of thanks. So On behalf of Biosetup Life Sciences, I, Ms. Neha Mahajan, Executive Organizer, would like to propose the vote of thanks. Firstly, I would like to thank ma'am for sharing her knowledge and giving her precious time and joining with us. Last but not the least, I would like to thank all the participants for joining with us and making this webinar a successful one. Thank you all.
Thank you very much.